I'm Brennan Wood, and I'm the Executive Director at Dougy Center, the National Grief Center for Children and Families located in Portland, Oregon. Dougy Center was the first children's bereavement center in the United States, started 41 years ago by our founder, Bev Chappell, in memory of a little boy named Dougy. And Bev was really the first person to start holding peer support groups for kids and families who were grieving. In the beginning, it was all grieving the death of a family member. And for many, many years, that was our focus on bereavement and bereavement peer support groups, as well as training and nationally and internationally and producing resources for families. And then we also started our Pathways program about a decade ago for families when a family member is living with an advanced serious illness. And we also have a new program, Light, for youth in foster care who are grieving. We do a lot in terms of direct support. We've served over 60,000 people in our direct peer support groups. And then we also train a lot of folks on understanding grief and supporting children. We have hundreds of available resources as well, tip sheets, activities, Grief Out Loud podcast, as well as books and videos. When we had the opportunity to apply to be a Childhood Bereavement Changemaker, we jumped at the opportunity because it was a really great time for us to do a deeper dive into some of the demographics in the greater Portland area as Dougy Center looks to expand our services, as well as to make sure that we are centering the right kids, that we're really in areas that where kids that need us the most find meaningful and accessible resources and support. With Dougy Center having a 41-year history in the Portland community, in a lot of ways, I think we felt like we did have our finger on the pulse of where the needs were. And I think that the opportunity to really do a deeper dive, offered us some new insights, but certainly really validated some of our plans in terms of expansion and growth. We definitely are utilizing the information that we found by being a changemaker to inform and really educate us on what some critical needs are. There has never been a time in the history of Dougy Center where we haven't had a wait for our services. And so certainly as we attempt to serve more and more kids and families, really looking at meeting those kids where they're at has been really a benefit of the Changemaker process. I think we gained so much from the Changemaker process and from the information that came out of the Changemaker process. I think, there were lots of big things and lots of little things that we took away. I think an overall deeper understanding of demographics has been really important, and recognizing that often the kids that are experiencing higher rates of childhood bereavement are potentially also experiencing ACEs or adverse childhood experiences in other aspects of their lives. And so understanding more deeply the information about kids and families that are experiencing childhood bereavement, so that we can really center those kids and make decisions about access and resources based on where they're at and also who they are. That's a place where I think Judi's House and Dougy Center really align, that it's important to have these conversations and to learn this information. I am consistently so impressed with the CBEM information and reports, and I think that it is such important, critical information, not just for Dougy Center or for Judi's House, but really for the field of childhood bereavement and beyond. And so we utilize the CBEM reports all the time in terms of how we talk about the kids and families that are in need of our support. And we use both the yearly CBEM information and reports, as well as the more topical CBEM data that you use to drill down on specific topics. And then also kind of the demographics of related to race and ethnicity. Those key findings are so important because it's really a matter of how we talk about childhood bereavement, and the CBEM information informs how we talk about childhood bereavement here at Dougy Center. And I know it does beyond Dougy Center, but throughout the field of childhood bereavement, I think it is critical information. The Changemaker information as well as the CBEM information really just continue to give us more opportunities to express what's happening in our community in really important ways. And we have that data to back it up, to say, look at how important this is, that childhood bereavement is truly, it needs to be a public health priority. And we have so much more information around that due to both of those sets of data. And I think it all has just helped us continue down this path of really being able to articulate why Dougy Center and all the wonderful agencies doing work similar to Dougy Center are so important. Dougy Center is deeply grateful for the work that Judi's House is doing and the JAG Institute is doing. It's just so important, and we're so grateful to be in partnership with Judi's House and JAG Institute.